welcome to the Trauma Treatment Collective vlog. Today we're going to be talking about shame. Shame is a very well talked about topic right now. If you have ever heard of Brene Brown, you've probably heard about her research that she's done on shame. I will actually link some different videos in TED Talks and things like that I like of hers in the description, because I encourage you to definitely go and listen. One of the things that I wanted to talk about in reference to shame is talking about treating it from a somatic perspective. A lot of shame work and a lot of things out there are a lot of talk therapy and cognitive based work, but I wanted to talk about the posture of shame. I think shame has a very very identifying posture. I think if you know what you're looking for, then you will see shame probably before you understand that it's shame, if you can kind of track a client's body. And so I wanted to take some time to kind of talk a little bit about that today. But first, before we get into that, let's get started with just thinking about what is shame. Shame is not trauma. A lot of times I think when I talk to new trauma therapists, they kind of see shame and trauma as one thing and they try to treat it the same. And I think you treat shame very differently than you treat trauma. Shame, I kind of tell my clients, my example or my definition of shame for my clients is that guilt is when we have made a mistake and we say, I've made a mistake. Shame is when we feel like we are the mistake. And so maybe you've heard of that particular definition, but I really try to explain to clients, like when you feel like you are internally at the very core of who you are flawed, or you're a bad person, or you're not worthy, or you're not good enough, then you're probably dealing with some type of shame. And so that's usually the definition that I give them, or the example that I give them to kind of help them identify shame. So hopefully that's helpful for you as you're thinking about shame, and then also as you are helping your clients think about shame. So when you think about shame, you think about, okay, so this idea that I am not good, I'm not worthy, I'm not good enough, or whatever it is that's coming up for the client, there's usually a posture of shame. If you'll do this exercise or this experiment with me as you're watching this video, you'll kind of be able to feel it. So I want you to kind of just set up and kind of set your shoulders back and erect your spine and kind of elongate your spine. And I want you to feel that and feel what that feels like in your body. Most people who feel that, they feel very empowered, they feel very grounded, they feel very centered, they feel very kind of, in a way, empowered. Now I want you to take a minute and I want you to round your shoulders, and I want you to kind of concave your shoulders in, so your chest will concave, and kind of let your back, kind of your spine kind of curve out. And then I want you to kind of look down. And I want you to notice what you feel as you feel this. Even as I do it, I'm noticing that it's harder for me to talk. It's harder for me to project my voice. My voice gets a little more shallow. I feel a little more weak. I feel a little more vulnerable. I feel a little more exposed to the world. And so that concaving of the shoulders, pulling in of the chest, that curvature in the spine is one posture, or a very significant posture around shame. I'm not sure if there's other postures, but this is the one that I know to look for. If you know of other ones, or you've noticed other different body postures in clients who struggle with shame, feel free to say something in the comments. I'd love to hear what you guys are seeing in your therapy session. But this curvature of the spine, the concave shoulders, the pulling in, the dropping of the eyes, those are all signs and symptoms of shame. That shame is on board, shame is somewhere around. And so when you start to see a client kind of do that, you can kind of start to be curious about whether there's shame on board for them, or whether they're struggling with shame, or as they're talking about something, maybe they have some shame around that. Some other signs and symptoms that are outside of posture may be intense amounts of anger towards themselves and maybe towards others. Very critical of themselves. So I like to say the inner critic is very loud and very proud. And a client will kind of cut themselves down every time you say something positive. They'll cut it down, or if they're thinking something positive, if they're thinking something positive, they'll be like, well, but then I think, and then that's the critical voice that kind of comes in. Also self-blame. A lot of self-blame, maybe some self-loathing there, and negative core beliefs about themselves and about the world, and maybe even about others. Just this very sense of just I'm not good, the world's not good, I'm not safe, the world's not safe. Just a very strong sense of just a lot of negative core beliefs. So those are some things that you might see when you are noticing shame in a client. So when you track shame, you want to track in the body posture, like I said. So you're looking at the shoulders, you're looking at the curvature of the spine. You're also maybe looking at how the chest is maybe caving in. You're also looking for eye positioning. A lot of times clients really struggle to have direct eye contact when they're struggling with shame. They will look away or look down. It can be kind of that downcasted eye. So you're looking for those things. Ways to work with it. When you notice shame, you can work with it from a cognitive perspective. I've read a lot of different things about working with it from a cognitive perspective. When you watch Dr. Brene Brown's work, she talks a lot about empathy and using empathy to combat shame. I love her idea of the Petri dish. And if you had a Petri dish and you had shame in it and you dropped little drops of empathy in it, shame would not be able to survive, because shame cannot survive in the same environment that empathy is. And so that's her big way of dealing with it, or one of the ways that she really promotes dealing with shame. And then I've also read things about being able to give the shame back. So helping clients to trace back where they got the shame from. So who initially shamed them, or what system or organization or institution initially shamed them, and then working with them to be able to give that shame back and not to carry that shame on, and then not to pass that shame through themselves. Because inevitably, if we are carrying shame, then we are passing that shame on to other people. And so I talk with clients about that. We don't want to be carriers of shame, because we don't want to shame others. We don't want people to feel as horrible as we feel if we are carrying shame. We don't want to be the perpetrators of shame on someone else. But if you're wanting to work with it from a somatic place, I always encourage my clients to just feel what it feels like to be in that position. So I help them to notice where their body is, to track sensations in their body and what's happening in their body as they are in the shame posture. And then I have them to slowly work out of the shame posture. So I may have them kind of lift their eyes just slightly, and then to track what happens, and then lift it slightly more, and then track what happens. And as we're tracking what happens, we're processing what's coming up for that client. And each time that we're lifting their eyes, then we also notice what else is happening in their body. Or we may start with the shoulders and just kind of drop the shoulders back, and we keep the eyes down like so. And we just kind of pull the shoulders back a little bit and kind of notice what happens in the body, what kind of thoughts come in, what other sensations they may notice. And we kind of go about that, kind of tracking that. And so that's really helpful too, in being able to help clients kind of start to work with shame. Because as you unfold the body, if you will, you're also allowing, very slowly as you unfold the body, you're also allowing for thoughts and ideas and things to come in for clients to help them to be able to process what's happening for them. So that's something to think about as you're working with shame. So there's multiple ways you can work with shame. There's lots of different things you can do with shame. I think the first thing is being able to identify shame, and then helping clients to be able to process shame in the way that feels right for you and also feels right for your client. Hopefully this is helpful as you think about shame. I've heard shame being referred to as the twin to trauma. That's the biggest thing I can say is shame and trauma are very different. They are very similar. They run in the same places, but they are very different in the way that we treat shame and the way that we treat trauma are very different. But usually if you're going to work with someone who has trauma, you're going to also work with someone who has shame. So hopefully this is helpful as you are on your trauma treatment journey. Have a great rest of your day and take care. Bye-bye.